everyone. Thank you for joining our community discussion on navigating the holidays. We began holding these online community discussions earlier this year because we saw a need to call attention to the rising issue of opioid misuse and overdose in our community. Since 1999, the rate of drug overdose deaths in San Juan County has more than doubled. And according to the New Mexico Community Survey, the percentage of people who currently use painkillers to get high has also seen an increase. San Juan County Partnership brought together an opioid misuse and overdose prevention group. This group consists of local organizations and individuals who want to see positive changes happening in San Juan County around reducing overdoses and increasing access to recovery services. Today, our discussion is around the stress of the holidays, especially now when not only will we have the normal stressors of the holiday season, but we know many people are facing new stressors and new isolation this year. We have a panel of local experts to talk about some good self-care strategies, as well as some new resources in our community and state that can help with substance use disorders. So let's introduce our panel. To my left, we have Amber Layton, Dr. Amber Layton from ATV Counseling Services. We have Bonnie Kidd across from me, a peer support specialist, Kim Dutremaine, CEO of Cottonwood Clinical Services, and Sue Hodgman, Behavioral Health Services Director of San Juan County. And joining us from afar on Zoom, sorry that you're missing the party in person, we have Wendy Lindbrink Allison, New Mexico Program Manager for New Mexico Crisis Access Line. Thank you all for joining us today. Yeah, thank you. Yeah, I was like, this is where you respond and say, yeah, mutually, we love to be here. So we're going to start with you, Sue. Why don't you tell us, we have a very, very exciting development, I think, going on right now, and we've been waiting for this. So why don't you go ahead and tell us about it?
Thank you. So as a result of the behavioral health gap analysis that was done a year and a half ago, the county's determined that one of the connecting points that was missing was some kind of connecting point for all the behavioral health providers, for people trying to find services, make connections, navigate the systems. And so we've created the Mental Wellness Resource Center. And it is a building now. It's official. We're opened. We're located at 814 West Maple. Yay! Our number is 505-636-7110. It is staffed by peer mentors who are experienced in overcoming obstacles in behavioral health, physical health, mental health, and all sorts of issues with life. They're there to help people learn how to figure out the best form of treatment for themselves, to investigate various treatment modalities, to look at the list. We have a behavioral health resource directory that is posted on our website and also on the Mental Health Task Force website and the San Juan Safe Communities website, where you can go and you can look to see what the resources are, but they'll help people navigate the systems and understand, okay, I've got this going on, where do I want to go, how do I want to do it, how do I get hooked up with them? So while we don't do direct referrals, we help them make phone calls, we help them ask questions, we help them figure out how they're going to pay for certain services. We also have a very extensive list of all the other resources in the county. And so you can work one-on-one with a peer mentor to help you figure out what's worked, what doesn't work, what do I need, and how do I want to get it, as far as behavioral health services and all other services as well. We can be reached by phone. Like I said, you can call and make an appointment. You can walk in. Or you can check us on, we have an email address that you can also call, or we don't call emails nowadays. We access online. Some people do, maybe. I don't know. But you can email us also with your questions, and we'll work with you directly to help you figure out how to get those mental health situations solved for you on your own terms. And I think that's it.
Right, I think that's it. So it's across the street from the hospital, right?
Directly across from the ER entrance. We're right on the corner of Lake and Maple Avenue. And we do practice COVID-safe practices right now, where we check your temperature and ask you to wear a mask and all that. But just have to knock on the door. You can call and set up an appointment.
I think it's great. We've talked numerous times in this kind of forum about all of the hurdles in between folks who are struggling and getting services. So I'm super excited.
Yeah, and very often if a person is in crisis or struggling, if they can't get the answers they need or can't get an appointment right away, they just drop the ball. And very often people fall through the cracks because they can't figure out how to pay for stuff.
Right.
And so we don't want people dropping through the cracks. We want everybody to get the help and the services that they deserve and that they want.
That's right. Very good.
Thank you.
Yeah, thank you.
Thank you.
Pretty exciting.
Glad you're open.
Yep.
It is exciting. So we have two topics that we were talking about here. One is the opioid misuse and substance use topic. The other one is the holidays topic. So, and then now they're colliding. So who would like to speak first on either of those issues? This is a free-for-all. So one of you can go ahead and take a crack at it.
I'll take a crack at it. I'm Kim Dutremaine with Cottonwood, and we have an agency whose primary specialty is addictions. And holidays are difficult. COVID is difficult. It's like you said, worlds are colliding in a whole lot of ways, and we usually see a lot of relapse during this time. A lot of people dropping out of services, just not showing up, that sort of thing. And then you add COVID on top of it, which has really made it difficult. So we're doing a lot of just trying to be creative. Everything now we're doing via Zoom, unless we have high acuity clients. So people who are really at risk of relapsing or suicidal or whatever, then we're doing face-to-face sessions, trying to get them in and serve them the best that we can. But just really utilizing things like peer support and other people that can connect with them when they're not in services, that sort of thing. Reminding them, you gotta get on your schedule, you gotta get up, you need to be at the session. We call them afterwards, hey, where were you? What's going on? What do you need extra? What can we help you with? Oh, you don't have internet? Let's figure out how to get that for you. Just really trying to be creative. And so I think like a lot of the 12-step meetings are virtual at this point. Some are in person, some are virtual. People are really needing that human connection. So we try to accommodate that the best that we can. Peer support persons are willing to go, we'll come meet you. Where are you at? What's going on? That sort of thing. One of the things that Cottonwood is doing, we've recently added physical health to our behavioral health in that we've opened a gym and we've hired a licensed trainer who's also a licensed substance abuse counselor, and we've tied it in with our intensive outpatient services. So we can have 5 people in the building at a time. Medicaid can transport them there, so there's not that issue. And that way they can get up, get moving. We can have a session while we're working out. We can do those things because physical activity, what we know is it helps with good endorphins. And in addiction, that's something that we've really got to get moving. So we're hopeful that this will be another puzzle piece to just help in that recovery process.
I had not heard about this gym.
Yeah, it's exciting.
That's a
Yeah,
really
It's on
great.
Main
When did this
Street.
happen?
So we're in the process of remodeling
Yeah.
right now. It's right across the street from Boone's Thai Food, which is
perfect.
Oh, that's
good.
what the gym is.
Yes, right next door to Bank of the Southwest. So it sits on the corner of Mikasa and I'm from New Mexico. I do the food places.
Yeah, the food landmark.
Lock and Main Street,
That's
corner
great.
of Lock and Main.
That is great. That's
Yeah.
amazing. That happened. Was that open during the COVID-19 crisis, or did that happen before?
We're doing it now.
So it just started.
Right in the middle.
I like it.
Right.
I
So
like
the
an
idea
organization
was
that decides to start something new when everything's shut down.
Right.
That's what I'm
You
talking
gotta
about.
adapt.
Cottonwood.
You
That's
have
what-
to,
yeah.
whatever it is.
Yeah, I think that's awesome.
Yeah, and so then we'll have incentives. So if you choose to put that as part of your treatment and your recovery process, and you're doing well and you're staying clean and you're done with intensive outpatient services, we'll give you a free membership for a year, incentivizing the desire to stay sober. Because
Yeah.
sometimes that's you need a little something to. Hey, I want to keep doing
That's
that.
good. That's a
keep
good
going.
idea.
Yeah,
So
that's really cool.
yeah.
So Kim mentioned a lot about the peer support. So this is a great time to turn it over to you, Bonnie, because that's your wheelhouse, having been somebody who has your own story and your own struggles, and now you're working as a peer support specialist.
Yes.
So like, tell us what that role is and what you guys do for people, because it's such an important piece.
Well, I am involved fairly heavily with Narcotics Anonymous, and I also somewhat with Alcoholics Anonymous. What we do, I've had the counselors at Cottonwood and also independent counselors have their patients, their clients, give me a ring or somebody, and maybe I can sponsor them, which means I kind of I help them go through their steps. I go to in-person meetings still. You know, we keep it small and socially distanced, but I take people. If it's their first time, I will take them to 2 or 3 meetings, and hopefully they'll, you know, get their own wings and fly. But if not, I'll continue to sponsor. We have, you know, anybody that has clean time, you know, at least a year clean time and has done the steps and stuff, they can all sponsor. But what it is more of a, it is peer support. I have my story, and it's it's all over the place. 40 years of it. So I find that I do well with young women. I usually have a carload of them. You know, or 2.
Like a Mama Bonnie.
Yeah.
Thing. That's like what I'm imagining.
And we kind of careen down the road like this. They
is
laugh
what
at
I'm
my
imagining.
driving. Help do the 12-step calls, you know, when people call and need help in their addiction at the moment. We can go in and get rid of their paraphernalia and their drugs. Or there's a lot of different options, because with everything going on here, and then like I say, they coordinate with those of us that do the not so much a professional capacity. Mine is like a
Building a network of support.
Yeah, I had a drinking problem for years, a drug addiction problem. I've been through the legal system. I've been through the probations a few times. So I can go in there with these people and they can relate to me. A lot of times they need somebody that's been there. And yeah. I've been there.
Yeah.
So a lot of humor. To me, recovery has to have humor. People come in not having much hope, and sometimes they're like, why is everybody laughing and happy? Well, because this is what happens when you get involved in recovery and you get clean and you start running around with people that are clean and that are in recovery. It becomes a lot of fun. I meet new people all the time. I don't know what to say. I was with a girl last night at a meeting that had went out totally, but she picked up 2 years last week. You know, people come in and out. Sometimes they're not ready, but that doesn't mean we're not ready and waiting there for them with open arms. We don't shoot our wounded, and we welcome anybody. We have nothing but the best in mind for them.
Can I ask a question? Are you a certified peer support person?
No, I'm not.
You should be.
Right. Yeah, I was just thinking that. So you're going to talk to Kim right after this. And she's going to hook you up, because I agree.
Yeah.
You want to just quickly tell people what that is?
Yeah, let me throw that in there, because certified peer support workers, so we have a couple that work for us, and they kind of do the same things you do, but then they have the ability to do some other things, like get Medicaid hooked up for people and find housing and just some of the other pieces that Sue was talking about, and and get paid for it. So
Right. So why are you not? I'm with her. Let's do this.
But it's an awesome, it is an awesome thing, because people need those connections, especially in recovery, and even behavioral health recovery. of any type, those connections are so important to have. And there's so many things that you guys are able to do that other clinicians aren't able to do. We need,
And that's
need
one of our
volunteers.
goals with filling the gaps, is creating a peer support work
That's right.
industry.
Absolutely.
And
whatever.
I'm all about the certified peer support and all, but I would also like to say that what I do is a labor of love.
Absolutely.
It is so rewarding to see somebody come in and get that light in their eyes and get excited about recovery, start learning the language. I always said, I could speak ghetto pretty good, but when I came into the rooms of recovery, I learned a whole new language, and it was really, it was freeing, very freeing. So I still got that free bird, free spirited part of me. I think I would do fine getting paid, but then
You
it
wouldn't
would be a
lose
job.
it. You wouldn't lose it. No. It is what
Nah,
you
you
make
wouldn't
it.
lose the passion. Trust me, the
yeah,
best thing to
it's,
do is to get paid for your passions. Thanks, space and health companies. So I want to, I do want to bring Wendy and, of course, Doc in on this. Doc, I'm going to save you for holiday stressors and self-care and all of this stuff. And
fine.
also you can jump in on all of this, too.
Great.
Let's turn to Wendy, because a lot of this is about accessing when you're struggling or in crisis. And one of those points, of course, is AA, and NA is free, and it's readily available, and it's happening all the time. Wendy, why don't you give us a rundown on what the New Mexico Crisis Access Line is? What do we use it for? How do we access it? Your turn.
Well, thank you so much for inviting me into the conversation. It's been great listening to all the wonderful community-based programs that are so essential for people to engage in finding recovery or maintaining recovery or supporting somebody in recovery. And, our program wouldn't be successful without those community-based programs, because we are not a replacement of any of those services that are offered at the community level. What we are is a place for people to engage with in the moment they need somebody to talk to. So they may or may not be involved in those community-based services yet. And we can help them with getting connections to the community-based services. We can help them with finding some strength to help themselves in this moment if they're not yet ready to engage in the community services. We can give them information on the services that are available in the community to help them take their next step beyond the call. And, our programs are expanding recently. And so we're really excited to be a part of the system of care here in New Mexico. We started 7.5 years ago as just the New Mexico Crisis and Access Line. We're a program funded by the state of New Mexico Behavioral Health Services Department under the Human Services Department. And we were just initially a 24/7, 365 hotline for people to call. We're not wanting people to think of us as a suicide line, but really as a mental health line, because we are here for anybody's mental health needs, whatever's going on. We want people to know that they can call us before a crisis results, during the actual crisis, or after the crisis. And that all of our staff are professionally trained on our crisis lines. They have their bachelor's, their master's, or their PhD. And so you're getting somebody with the skills to help you through those moments that you're experiencing some sort of mental health or substance use concern. And, we're just here to hear you in those moments. And we've been able to expand on the service arrays that we offer since that initial program was introduced into the program 7.5 years ago. And we now have the healthcare worker and first responder support line, which is a line dedicated for our essential workers that may need some place to talk to because of the vicarious trauma or the emotional distress that they're experiencing during these times. So we have a dedicated line specific for them to call and engage with. We have the peer-to-peer warm line, which is a place for people to call in the evenings from 3:30 to 11:30, or to text from 6 p.m. to 11 p.m. to talk with somebody that also has a lived experience and is in recovery. And they are certified peer support specialists like you all were just talking about. And they can support somebody in an empathetic way, because not everybody wants to have a clinical intervention and wants to have that professional behavioral health engagement that we offer on our crisis line, but they do still want to talk with a professional mental health that's been there before, because a lot of people that are working in the mental health field often move into this field because of their life experiences. And the differences that happens in the crisis line and our clinical staff are that it's not a component of their job role to share their personal history, but a peer support's job role is to share a component of that history and to help that with building connections and reinforcing how to get there and how to move forward. And so, it's just a different way to approach somebody's care, and there's no wrong door. So you can call either of those two programs and reach somebody that's going to be here to help you. And, you might hear our call taking staff say, you might really benefit from calling the other program to support you in your needs next time because they've been there before. Or you might really need to talk to somebody that's got a little bit more expertise than I do, and can I transfer you over to the crisis line to support you with your current mental health needs, because I'm worried about you and I want to make sure that I'm giving you the best possible care that I can. And so, those programs have really helped fill in some gaps in our communities, because a lot of mental health agencies aren't open 24 hours a day, 7 days a week. And sometimes mental health concerns occur outside of Monday through Friday, 8 to 5 business hours. And so we are here in those moments when somebody needs to talk. And we encourage people to think about how to help themselves. And we encourage people to think about when's the last time they've saw a provider, or we, again, refer people back into the community to talk about what's going on with them and become involved in regular treatment, because we are not that replacement for treatment. We're just here in that moment, and we're not going to be able to offer you to be able to talk to the same person in every single phone call. And so we just really feel like it's important for people to know that there's always somebody to hear them and to talk to, and that there's no wrong door, and it's free. You can be anonymous. You don't have to give us your demographic information. But during these times when people are isolating and social distancing and withdrawing from the community and the engagements with other people, we also know that sometimes it's not always comfortable for somebody to engage with somebody via a live conversation. And so we have implemented 2 programs this year that allows people to find ways to help themselves. So we introduced an NM Connect smartphone app where you download it onto your phone for free, and you have the numbers at the touch of your fingertips if you do decide you want to call, but you also have access to resources so you can find out how to help yourself. You also have access to access videos on the NM Connect app. So if you just want to build some resiliency and listen to some videos, then those are available on the NM Connect app. And just within the last few weeks, we released a program that is a self-guided digital wellness tool. And it's for people who experience substance use and behavioral addictions. And it is an online website that people can go to and watch videos, do some self-assessments on the computer, listen to other stories of people in recovery, hear what's going on with how to help yourself and why this might have happened, how you might have gotten to this place that you are in life. And because it's video based, you don't have to read everything. So it allows you to hear the perspective of our professional team and understand what's going on and how to move forward. And then, of course, on that website, it does offer you resources to take that next step. And it's designed for anybody, no matter what stage of recovery they are in, whether they aren't yet ready for recovery and in that pre-contemplation place where they're thinking about it, or they're in that place where they just need some additional strength to go along with what's going on with their current treatment plan, and want to hear from somebody else. And so all the videos are only like 2.5 minutes, and there's over 100 videos to listen to. And we're just really grateful to be able to offer this new way to access care and build connections within our communities, because we know during these times people are experiencing mental health concerns that they never thought they would have experienced before. And, you might have gone through life and never had a mental health concern. And then as a result of the pandemic, you now might be facing job loss, financial insecurities, additional stress trying to figure out how to work from home and raise your children and help them with school while you're trying to work. And, a lot of different things are happening. And there's a lot of loss of life and grief that people are experiencing that they never thought that they would have to navigate through and understand how to deal with. And so I've been working with the State New Mexico Behavioral Health Collaborative to create a path to wellness programming with the state. And we're sending out Mental Health Monday messages on NM Connect through our email distribution list and posting them on our website that offer information on different tools and different reinforcement messages of hope, because people really need hope during this time. And we need to make sure that we are offering people access to find hope when they don't know where to go from here.
Great. So that was a lot. So I'm going to try to do a summation. I was like, where's my phone? Because I was going to download the app while I'm sitting here just to see how easy it was, but I'm sure it's easy. So I heard in there an app, NM Connect app, right, for a smartphone, that there is an email list to get access to, that on the website there are videos that people can cull through themselves. And then, of course, you have the 2 hotlines that are available to people. So what do I call? What's the number to call? And what's the website? I'm assuming that once you get on the website, there's the numbers and the emails and stuff are all there. But so let's start there. What is y'all's website?
Our website is nmcrisisline.com. And yes, you can find information on all of our programs there. But if you can't remember nmcrisisline.com, you can always call us at 1-855-NM-CRISIS, which is 855-662-7474. So the main theme there is NM Crisis, whether it's just to call or whether it's to access our NM Crisis line. And so thank you for that. And if anybody has any questions, please do go on the website and check it out and let us know.
Thank you. All right, Doc, it's your turn. So you can actually speak to anything that you've heard or just any current musings or whatever. Go. If you need a direct question, then you can look back at me.
No, I think we're good. So a couple of things that both Kim and Bonnie had mentioned in their discussion was about safety and connection, which is really a behavioral health standpoint. Behavioralists look at we need that, right? And so when I was asked to kind of do this forum, I was torn in the middle, because there's part of me and in the work I've done where there's clients that are I don't have to be around my toxic family this year because the governor says I can't leave the state, right? And so they're kind of excited. I don't have to. I socially don't have to. And so it's interesting that they're kind of get off the hook, right? Because maybe that was not safe for them to be around those family members. And then we also have the other side of the spectrum where it's because people can't leave, they don't have that safety and connection. So really looking at what is everybody's own safety need and how are they connecting? And it's kind of individualistic. And that's where the self-care ties into it, is knowing I haven't seen anybody or talked to anybody in 3 days and I'm feeling really anxious or really down, and being able to say, I need to reach out, whatever means that is, whether it's professional help or a colleague, a friend, a group, peer support, being able to engage so that you're kind of hitting that behavioralist spot of connecting with one another. But I also think, she had mentioned, there's a lot of grief going on, and grief a lot of times people think is death, and it's not true. We can grieve over a lot of things. And so being aware that there's many people grieving lots of different things right now because of the pandemic, and it's okay to be grieving, and it is a process that we all go through. As well as not feeling guilty. You know, like I said, we have this kind of side that's happy. They don't have to be around toxic families or events or societal things, but also not feeling guilty for not being around them. And so kind of just monitoring, like, is this because society says you have to be around your family for the holidays, or, you know, have I really just had zero human interaction for so many days or weeks or months? And I think just really kind of knowing where your emotional basis is stemming from, and like the peer support that Kim and she had mentioned can help you find housing and food and all of those things, which is the bottom of the pyramid. Like, we have to have those basic needs. Doesn't mean we have to eat 900 Christmas cookies, but we also do
I never
need
put a number on it. I just
we also do need to make sure we are eating. I have a lot of clients that struggle with anxiety, and I'm like, when's the last time you ate? And they're like, I don't know. And I'm like, well, your stomach's telling your brain you're dying, so you should probably try to eat. Those are little things. We laugh, but it's those little signals that our physiological side is going, hey, we're dying, we haven't ate. You're probably not really, but that can help to decrease our anxiety some. And yes, it's a high sugar, high carb time, but also being aware of, like, what is healthy food? What does that look like? Where can I get healthy food? Where can I work out? Luckily, we're not probably going to have a white Christmas, I guess, so it's warm out. We can still go walking. I mean, try to look at the positives here. So going outside and walking and getting fresh air and sun, right, vitamin D exposure, like all of those things are really good self-care. I think a lot of times when the topic of self-care comes up, people think money, like, oh, well, I don't have money to go do this or that, or they're shut down. But self-care really doesn't have to be expensive, and it doesn't have to be, you know, a professional service. It could be taking a walk or reading a book or watching a video online. The other thing I think that I would say is monitor your exposure to the news. It's very triggering for a lot of people. I have a client that has a shot phobia who's 10, and they were talking about the COVID vaccine, and he like broke down crying. And he's not getting a shot, but he just hearing it. And so really monitoring, like, what are you exposing yourself to electronically or with the TV? And I'm not saying don't watch the news, but definitely you don't have to watch it all the time or every day. And just know that you have those choices when it comes to whatever your safety looks like. If you don't believe in the masks, but you know, there's people who are vulnerable, so be kind to others too. Like, it's not just about your own perceptions. We also have to be aware of how we may be impacting others during all of the holiday stuff.
Now, can I add on to that for a moment?
Absolutely.
I think that it's so great that we're talking about self-care, and I just want to recognize that because so many people are not working in their places of business where they used to be working. I mean, there are still a lot of people that are going to the office, but there are a lot of people that are working from home now. And it lends to us not recognizing some of the signs and symptoms when people aren't engaging in self-care. And so it's just so important to make sure that we're checking in on each other as well, and making sure that we're building those connections and maintaining those relationships, because there's not somebody to tell if you're intoxicated by 5 o'clock, and there's not somebody to tell if you're feeling fatigued as a result of, whatever's going on with you, because they're not seeing you slumped down at your desk in the office. And so it's so important to make sure that we're reaching out and building connections with people during these times.
Especially since you can turn off your Zoom camera. It's like another, right? That's another nonverbal cue that's missing.
Yeah. Well, it was funny. So I teach a psych class, and the other morning, my kid busted in my psych class, and luckily we were talking about social psychology, and I was like, I'm teaching, like, can I talk to you in a little bit? Because school was shut down. And she's like, no, it's an emergency. And I'm like, okay, what's the emergency? She's like, the elf's gone. And I'm like,
the elf, is this like the elf on the shelf thing?
And I'm like, okay, not an emergency, but but so we also have to remember for these little kiddos that are in our life too, like, it's definitely not an emergency, but to her it was. And like, they're not able to, have their friends to talk about these things, or even their teachers, or bus drivers or cafeteria workers, whoever it was that was special to them that they could talk to about certain things. And so just remembering to, like, they're scared too. They don't like it. They want COVID to be over. They want to go back to whatever normal was. And, you know, then you hit the middle-aged, middle schooler, high school kids that are like, I'm good. I'm not doing sports no more because we can't. And that's not healthy either, right? And so making sure that we are doing our parts to encourage activity and movement and collaboration in a safe manner, whatever that looks like.
Right, right. Yeah. Yeah, and I'll plug something that's going on with my affiliation. I don't even think I said my name. I was just like, hey, guys. So Megan Kopp, and I work with Basin Health Companies, so I'm here representing them as well. We are doing a community grief group on Wednesday evenings, 5:30 to 6:30, on North Orchard Avenue at the Unitarian Universalist Fellowship House, so it looks just like a house. And that's for, to your point, that's for any type of grief and loss, and that's open to the community. And we're using the grief recovery method, which is this evidence-based practice. Out of Kent State University did the study on it, so it's a very action-oriented sort of approach. But so I just want to throw that out there when we're talking about resources that are available to our community. We're getting close to time, so are there any other comments from you guys that you want to throw in? Yeah, Sue.
I'm a big proponent of walking. You can go out and walk 20 minutes and your endorphins kick in and you feel better. I notice that no matter how bad of a day I'm having, if I go out and walk, I feel better coming back, and I'm a totally different person. So, you know, it's cheap, it's free, it's easy, and it works.
Mm-hmm. Well, that taking a bath or a shower too, like, you know, when we're really down or even don't feel good, we forget to, right? And then remember your mom's making you, and then you felt like a new person.
Yeah.
So, and that's something most people have access to, right? Right.
Yeah, and if you're a person that, you know, isn't able to participate in a walking activity, just find a way to go outside and roll around and just absorb the sunshine. Because as you all mentioned, it doesn't look like we're getting snow anytime soon. And so take in some of that vitamin D and enjoy the outdoors and ensure that you are participating in self-care, and however that means for you, whether it's walking or bubble baths or doodling or talking to a friend, or sometimes it's just vegging out on the couch and not doing anything.
Definitely. Huge with the pet therapy. Yeah. Four-legged furry critters are, they are very therapeutic. I have 6 of them myself.
Any other additions?
I was going to make a comment about, I think Wendy said something about working from home. And I know a lot of the clinicians in our agency, one of their struggles is when I'm at home all day and I'm working all day, it blurs the lines between what's work and what's my personal life. And so we've talked a lot about turning work off, closing it down, making the switch. We don't drive home anymore, right? So we can't make the switch from work to home. And so to have some sort of ritual to separate those things, and don't be checking emails at 7 p.m. and all of, you know, because my computer's right here and I'm used to being on it all day, and to really shut that stuff down and make the transition from work to home, even though you're at home.
Keep a schedule.
Yeah. Very good.
Yeah, healthy boundaries. Well, and we at ATB, we have some sessions that we're doing in person, COVID safe practicing, but sometimes the clinicians just come in so that they can separate their house. Because I work harder at home, like, because the laundry needs done in between sessions. And yeah, it does. It just soon it's like all mixed into one. And so even if you're able, or your boss will allow you to even just go there once a week to get out, even if it's virtual from your office, I think those are healthy things to do as well.
Yeah. Very good. Everybody's like looking around. I think it's my phone.
No, it's me.
It was me. That one you can't
it's
find.
you? Okay.
Yeah, sitting over on Rocco.
Okay. That means that we're formally at time. So thank you so much, Dr. Amber Layton from ATB Counseling, Sue Hodgman from, gosh, your line is so, your title, Behavioral Health Services Director for San Juan County, Kim Dutremaine, CEO of Cottonwood Clinical Services, Bonnie great peer support with the NA and AA community, and we're going to try to get you. I'm gonna make sure that you guys talk right after this.
No, she's mine.
Okay,
She's like,
we
"No,
all
don't
want
steal
Bonnie.
her."
I don't care who takes her. She just needs to be out there more.
Nice to be one.
Just use her as much as we can.
Right.
And I'm Megan Cullen from Basin Health Companies, and we will see you next forum.